y'all. Thank y'all for coming today. Today we are going to talk about how's my balance, how safe is my environment. So this is one of a 5-part series on active steps you can take to identify risk factors related to impaired balance and how you can prevent falls. We hope that you've had the opportunity to join us these last few days and for lunchtime, and will continue to join us the rest of the week as we learn about topics during Fall Prevention Awareness Week. My name is Kim, and I am going to be your moderator today. We ask that you make sure that your microphones are off during the presentation. You are welcome to keep your video camera on, but if your connection is poor, you may want to turn that off. Both of those controls are on your, both the controls for the microphone and video are in the lower left corner of your screen. If you are connecting with us by phone, you can press *6 to both mute and unmute your phone. And we will have someone at the end of our session who can assist you with this if you're having difficulties. As you think of questions for your presenters, you're more than welcome to use the chat box at the bottom of your screen to type in those questions, and we will answer those either live or in the chat following the presentation. You may also click on the raise your hands icon at the bottom of the screen, and we will assist you on turning on your microphone during the question and answer period. Now, I would like to introduce our presenters today. First, we have Dr. Kathleen Camp. She is an associate professor at the University of North Texas Health Science Center in Fort Worth. She has been practicing physical therapist for over 20 years in areas of acute care, home health, and outpatient rehab. She is a board specialist in geriatric physical therapy and a certified exercise expert for aging adults. Kathleen is also a certified vestibular specialist and assists clients with balance and dizziness issues. She has current research and interest in bone health and fall prevention, and she has served as the chair of the Fort Worth Safe Communities Coalition's Fall Prevention Task Force and serves alongside many partners to promote fall prevention programs and innovations. And next we have Jennifer Wilson. Jennifer is an occupational therapist and graduated from Texas Tech University in 2005 with her master's in occupational therapy. She has worked in the acute care setting, inpatient rehab, outpatient therapy, and is currently working with Rehab Without Walls, where she works with individuals to increase their independence in their home as well as in the community. Jennifer enjoys reading, crafting, and being with her family. I would like to thank you all again for joining with us today, and now I'm going to turn it over to our presenters. Thank you.
Thanks, Kim. So one of the first things we wanted to bring awareness to was we talked about, again, how's my balance and how safe is my environment. So there really are overlapping factors that are for consideration for our risk for falls, and it's usually a combination of factors that really impacts our fall risk. And oftentimes, many of us may have some in each or several of these categories, but the good news is that many of these factors we can change. So, thinking about the active steps that you can take to make an impact in any one of these areas could really have an impact on decreasing your fall risk. And even thinking about having a conversation with your family or your physician to also help direct and maybe support you 2 steps about making changes. So in the lower left-hand corner, you see the psychological component, and there's many factors that sort of fall under this category. One of those is dementia. We've all heard about dementia. It can be really related to several medical conditions, but the good news that research has actually shown that exercise and physical activity can really slow the progression of dementia and cognitive decline, and really improve our ability to sort of manage even some of the behaviors associated with cognitive decline and help us with memory. Risk-taking behaviors, that sounds like something like a teenager would do, but we all have the tendency sometimes to take some risks, And when we think about it with falls, sometimes it can occur with older adults when they continue to try and do some activities that maybe isn't abnorm for them. So, you know, the fall season comes around and we decide that we want to clean the leaves out our gutter, and we don't get up on a ladder often. That's definitely going to be a bit riskier activity than we would normally perform. It can also be associated with that condition of dementia. Sometimes we may even take even higher level risks that really we should have, again, better sense not to do. But again, this is associated with some psychological factors that can increase our risk for falls. Also along that category is depression, and that's something that is, you know, being talked about a lot right now, especially with these current conditions of COVID-19 and the social isolation that's occurring, especially if you live alone. And we know these two are tied together. But again, the good news is that we can find safe ways to continue to remain active. We can help control the issues related to depression, and even that regular physical activity can, again, both impact the depression as well as our fall risk. And along that line as well is fear of falling. Fear of falling is really real. You know, we all have certain concerns, but it can be very paralyzing, both for concerning activities. Maybe you would say, I'd never get up on that ladder, you know, and have a healthy level of fear for that. But sometimes that concern that people have about a certain activity starts to bleed over into daily activities, and so they become less and less active. So finding a way to overcome that fear and overcome that concern and build up your physical ability to safely do those activities can greatly make an impact. And then yesterday you heard quite a bit about medications, and we know medications have an important impact on our lives at times, but they also have some side effects. So with that, you know, taking into some of the advice, hopefully if you joined our conversation yesterday, to be aware of which medications can impair your balance or judgment. And then again, thinking about talking to your physician about maybe, you know, any potential changes so you could reduce that risk. But also remember, forgetting to take important medications can also impair your mobility. So forgetting those important medications that help control your blood pressure, control other impacts of health-related needs can also make an impact. So the second category you see there in the blue is physical. And these are the things that we often think about, again, with regards to what is it that I am doing that maybe has an impact on these factors, especially with regards to my activity level or my strength. And so we see some declines in some of these physical attributes, especially associated with normal aging. And although we can't reverse the clock in years, we can influence really how we age and the behaviors associated that might impact some of these factors. So the first item there is weakness. Weakness can be attributed to physical inactivity. And even just getting started with some regular physical activity or being mindful about being more intentional about being more active is the first step. But an even structured exercise program that addresses strength and maybe even addresses balance and aerobic capacity can make a significant impact. Vision is another thing. I think you might have heard, if again you were with us on the first day, Kim suggested the importance of having your vision checked regularly as well as your hearing. But vision can be impacted by some medical conditions, again, like cataracts or glaucoma or macular degeneration. These are all conditions that sort of impair our clarity with our vision. And so we rely on vision quite a bit to assist us with balance. As many of you guys know, you probably already turn on lights or grab your glasses, or, you know, you target something, you know, it does make a significant impact on your vision. But having those regular checkups with your physician to make sure, again, you are in the best condition as possible with that, with corrective lenses or with any procedures, can make a definite impact on reducing your fall risk. And then dizziness. This is a big umbrella kind of consideration with regards to things that can impact or cause dizziness. And I think, again, yesterday we heard some discussion about how medications make an impact on dizziness. So besides some of the medication side effects, there are also the heart conditions. You might have been with us and heard about that orthostatic hypotension, where our blood pressure might drop. It can be a simple sign of dehydration, and we need to drink a little bit more or watch what we're eating so that we're absorbing more fluids into our body. But it also can be associated with acute conditions, maybe a recent bout of an issue that needs to be addressed. And for anything that has a sudden onset of dizziness or an acute condition, especially if it's persistent or lasting, you may need to seek immediate medical attention. But if it's intermittent, it kind of comes, especially it comes whenever you move, especially even moving your head. These really could be addressed with very simple interventions. So I encourage you to talk to your physician about this. Both some physicians and physical therapists can address. As Kim mentioned, you know, there's a specialty of vestibular and balance therapy. So sometimes a simple intervention can help with maybe giving some relief of that dizziness, especially if it's impacted again by head movement. And then balance and walking problems, especially this is an area, again, physical therapists and occupational therapists, this is oftentimes the reason we get referrals for therapeutic intervention. And so it can be impacted though by poor sensation in your feet. For those of you that have peripheral neuropathy, which is poor sensation or maybe even pain in your feet, this can impact your mobility, as you already know. But these again are problems that can be addressed through therapy and even managing the underlying problems that impact those conditions. So thinking again about what you're doing to sort of control that those issues and underlying issues can make a big impact. Sometimes even again, things that might impact that are foot problems or footwear. So just knowing again, am I making good choices again with proper footwear? You know, and for some of you, you may also notice that you've got some changes in your foot structure that definitely impacts balance. So there could be, you know, better choices on use of footwear that can actually help provide some better stability. And then you see their heart rate and rhythm problems. So we talked a little bit about this yesterday. And even though our brain may be our control center for a lot of our function, it's our heart that really actually helps to get appropriate oxygen and nutrients to the body to help sustain activity and exercise and movements. And irregularities in your heart rate can also lead to those issues of dizziness that we talked about, maybe extreme fatigue. And so those can increase your risk for imbalance and falls. The good news again is just by having this discussion with your physician and maybe considering underlying factors that need to be controlled through medical interventions, but also possibly through exercise, you might see some improvement again with getting better rhythm and control from your heart. And then as you see there's several other chronic conditions that have been associated with increased fall risk. Arthritis, that definitely impacts, you know, painful joints. Good news again, exercise has actually been shown to help with arthritic pain. Persons that have had a stroke, diabetes, incontinence, and Parkinson's, these are all conditions that also have been related to fall risk because again, of the motor control and the neurological control of just that need and demand for walking. You see incontinence there because oftentimes, again, we get up to hurry to go to the bathroom and sometimes that rushing can cause. So there's, again, medical interventions and strategies that can help control all these conditions so that they don't necessarily increase your risk for falls. So how is my mobility? One of the things when you go to see your physician in the office, you know, this is something they should be having a conversation with you about and maybe even testing is how well am I moving and am I at risk for falls? And one of the tests that is used to assess this is called the timed up and go test. And this is a great test. If there's any one test that they're going to usually do in the office, it's this one because it looks at an ability to follow a command to rise from a chair, to walk a short distance. You see there 3 meters, which is about 10 feet, turn, come back and have a seat again. So it has components of the ability to rise, which oftentimes takes some strength, the control to manage that change in position, walking, which is often something that impairs sometimes, again, our control with mobility, and then speed. And all of those factors have been related to, again, fall risk. The gentleman that you see in the diagram is not using an assistive device, but you could use an assistive device for this task. And so as you can tell, the clinician there is using a timer. And so when you do this test, usually, again, they're going to give you those instructions, and any performance that takes longer than about 12 seconds is suggested that you might be at a higher risk for falls. Now, if you do have some of those underlying conditions like Parkinson's, or you've had a stroke, or maybe you even have some balance disorders that impairs you, there are different cutoff scores. But again, what we're looking at is not only the time, but the quality and the control that you have while you're performing this task. So that's called the timed up and go test. That might be done in your office or in your clinician's office or physician's office. So another one is looking at balance. This is one of my favorites. I do like this. This is called a 4-stage balance test. And as you can see there, there's a diagram of the feet kind of side by side. Now, that's not normally the position we like to stand in. As many of you know, when you're trying to increase your balance, you may widen your stance out. But again, we're looking at potential cutoffs that indicate risk for falls. So when we want to assess and determine that, we'll have you stand with your feet side by side. And this is usually about a 10-second test, and then we would move on. And if you can stand in that position safely, then we'd increase the challenge and have you go to that second position, which is called a semi-tandem, where you put one foot just slightly in front of the other. Same thing, if you can stand in that position for 10 seconds, then we'd make it really challenging and have you stand in that position number 3 of a full tandem position. That's one foot in front of the other, as though you were kind of standing on a balance beam or a line. And the cutoff for this is, again, if you can't stand in this position for at least 10 seconds, it's suggestive for a risk for falls. Normally, we'll assess it in both positions, with the right foot in front and then with the left foot in front. And if you plan to test yourself at home, I'm going to encourage that what you do is go to a safe place. We always go kind of to the corner of a room, maybe put a chair in front, or maybe even the corner in the kitchen, so that you have, something behind you and on both sides. And like I said, maybe even something in front of you. You can hold on while you acquire this position. And a lot of people say, well, I would never get in that position anyways to lose my balance. But if you think about it, sometimes when we do start to lose our balance, we actually move our feet to try and regain our balance. So there is a time period that sometimes you would be in that narrow base as you're trying to regain your balance. So, and then as you can see, the fourth condition is standing on one foot. Now, thankfully, the cutoff is not 10 seconds, but 5 seconds on this. You should be able to stand on each foot for at least 5 seconds to indicate that you would be at a lower risk for falls. And we do this quite a bit every day when we need to step up onto a curb, or maybe if we have to step over an item or step up and into the tub. A lot of times we do need to have that balance on one foot, and you may already be modifying or accommodating by actually holding on, and that's probably why you're holding on when you do that. Maybe both that you have impaired strength that allows you to bear all that weight and force through one leg, or decrease balance that allows you, challenges your stability. Or maybe, again, the concern like of a wet environment, like in a bathtub. So that's a 4-stage balance test. And then another one that I really like as well, and is what we call the 30-second sit to stand test. And this is a great test as well for looking at lower extremity strength that can really impact balance. Now you see somebody sitting on a line, but what that line there is a chair, and it should be a standard height chair, like a dining chair. And that chair, again, with this test, we do like to secure it up against the wall. And then from this test, the first thing that we'd ask you to do is, you know, can you even get up out of the chair with your arms crossed across your chest, as you see there, which means that you're not pushing up from the armrest, you're not pushing up from the seat. That can be a challenge right there. And if you're having challenge arising from that chair without using your hands, that's an indication that you might have some lower extremity strength deficits that would impact, again, your balance and raise your fall risk. But if you can stand from the chair without using your arms, then again, what we're going to do is set a timer for 30 seconds, and we're going to count how many times you can come up to a full standing position from that seated position. And in the chart that you see there to the right, hopefully our pictures aren't covering it too much, but you can see that there are some age and gender related norms. And even though it says less than, that's an average score there. So your age group with your gender, that's about an average performance that you should be able to do in that 30 seconds. Now, I will share and reveal that this is for people that are living in the community, are independent, you know, they might use an assisted device, but they're still fairly active. So don't knock yourself if you fall below this, but do understand that, again, in 30 seconds, you should be able to stand from a chair at least 9 times to reduce your fall risk. Once you get up into the age group of, you know, the 80s and 90s and 100s, we're going to give you a little reprieve on that. But again, a good indication of strength in your legs. And this can also be simulated to be a strengthening exercise for a home exercise program. So that's a little bit of a glimpse at the physical and cognitive issues. And now I'm going to hand it over to my colleague, Jennifer, to talk a little bit about the environment.
All right, thanks, Kat. So as y'all can see there over on the left-hand side of your screen, there is a brochure, and you can go to the study site, Stopping Elderly Accidents, Deaths, and Injuries, and you can actually check out this handout for yourself. But we're going to talk a little bit about the environment, because as you know, the environment plays a significant role in fall prevention, not only in your home, but outside in your community as well. And I know it's not always easy to make changes in your home, especially if that means getting rid of your favorite throw rug, which we'll touch on here in just a little bit. But there's also some barriers that can occur, financial and just getting the supplies that you need to make your home safe. So I would really recommend reaching out to your local area agency on aging, because they can offer some support and some assistance with some of those changes that might make your home environment a little bit safer. So one of the first steps to recognize hazard, one of the first things that we need to do is just recognize hazards. And so we're going to go through some of the things in your home and just look at some areas where there could be some potential dangerous issues. So first off, we're going to talk about your stairs and your steps. So if you have a home with multiple levels, or even if you have steps from your entryway into your garage or to your porch, that can cause a tripping hazard, or it can be challenging if one or both of your legs are weak. And we need to think about the things that we leave on there. I know sometimes, even in my house, it's easier not to make multiple trips up and down the stairs, so it's easier just to leave stuff at the bottom to be taken up at a later time. But if there are papers and shoes, books, any kind of other objects that are on the stairs, that can really be a fall hazard. And then also think about your steps. Are they broken? Are they uneven? Do they need to be replaced? Because if your steps are broken or uneven, that can be a very dangerous position trying to navigate the stairs. And then as far as the lighting goes, is there an easy accessible light switch at the top and at the bottom? Because if it's only at one spot, it's not going to help you very much if you're upstairs and it's dark and you need to get downstairs again. And then speaking of the lighting, the light bulb, if it's burned out, again, that's not going to be very helpful for you. And as we live in our homes, and as our homes get older, unfortunately, the carpet can get loose, or some of the woodworking can get loose. So think about that. If you're trying to navigate up and down stairs where the carpet is loose or torn, your shoe or your assistive device could potentially get hung up in there, which is also going to be a big tripping hazard. And then also think about the handrails on your stairs. You're going to need to make sure that you have one on each side, and make sure that they're not loose and that they're not broken. All right. And so now let's talk about kind of navigating through your home. When you walk through your home, do you have to walk around furniture? We like to call it furniture walking. But when you go through your home, you need to make sure that there's a clear pathway for you, and one that you can navigate, especially if you have an assistive device that you're using, such as a cane or a walker or a wheelchair. And now to the dreaded throw rugs. I know that they're great because they cover up that mystery stain that's been on the carpet for who knows how long and who knows where it even came from. And they're also really pretty, and they can help just with the ambiance of your home. But if your throw rug is curled at the side, at the corner, or if it's loose, navigating through your home, especially if you have an assistive device where it can get caught or hung on that, it can be really dangerous for you. So find a way to either get it secured or just consider, unfortunately, getting rid of it. And I know that's a touchy subject for some people. But also look around your floors and see if there's any papers or shoes left about. There's a 9-year-old that lives at my house, and there's randomly shoes left all over the place. So yeah, that's a tripping hazard at my house as well. Or books or any other objects that are left on the floor. And then think about the cords that you have as far as for your lamps or your phones. So these cords not only can be a tripping hazard, but a fire hazard as well. So what you want to do is just make sure that they're secured against the wall. If they do have to go across the floor in an area that you normally walk, just make sure that they're covered up with cable cover or floor tape. And then in your kitchen, the unfortunate part about being on Zoom is you can't see that I don't even quite hit 5 foot tall. So I completely understand the issues that arise whenever you have things up higher on the top shelves. So consider even rearranging your kitchen so that the things that you need to use most often aren't really high or even really low. And if you do have things that you need to keep up high, consider getting a step stool, and not just any regular old step stool. Make sure that it has a handle on it, and make sure it's got one single wide platform that will be a little bit more sturdy for you to use. And I really recommend avoiding the smaller ladder rungs that have multiple steps on them, because those are going to be harder to navigate up and down. And then in your bedrooms, you know, we all have to get up in the middle of the night occasionally for one reason or another. So I would recommend getting something to light your path, especially from your bedroom to your bathroom. And the lamps by your bedside table are great, but you need to make sure that you can reach it, because it's not going to do you much good if you're almost falling out of the bed just trying to turn your light on in the middle of the night. And then, excuse me, and then also consider the height of your bed. Newer beds, the mattresses are taller, the box springs are taller. So if there is a way that you can switch out your box spring to make the height of it smaller, that would be more beneficial to you, because when you get in bed, you want to make sure that you can sit safely and securely with your feet on the ground before you transition into either on your side or on your back. And again, we're talking again about the lights in your bedroom. Make sure that you have adequate night lights or something of that nature to make sure that you can safely get from your bed into the bathroom at nighttime. And then also I would recommend having a chair in your room to sit on, especially for getting dressed. It's going to be a lot more stable for you if you have a chair surface that you can sit on instead of standing or even leaning against the side of your bed to try to do this. And then in the bathrooms, think about when you get out of your tub and your shower, the floor is pretty slick because it's wet. So you want to make sure that you have a good, secure, sturdy, either non-skid mat or even the strips that you put in at the bottom of your tub or your shower. And grab bars are always a great way to go to put either in your shower or beside your commode as well. They'll assist you with getting up and down and also assist you by your commode when you need to adjust your clothing. And they also make some really great chairs that you can sit on as well in your shower or your tub, just for safety reasons. And so I think our big main takeaway here is we want to keep moving, stay active, and maintain balance to help prevent falls. You see there listed is the cdc.gov website, which will also have some really great tips. So I'd recommend you going to check that out and see what else you can come up with.
Thanks, Jennifer.
Thank you, Kat. Thank you, Jennifer. Do we have any questions? If you have a question, you're more than welcome to raise your hand and we can unmute you. Or if you have a question, feel free to type it in the chat box. If you are on the phone, please remember you can dial *6 and that will unmute you so you can ask a question. So Jennifer, I have a question. You had mentioned earlier that there are places that can assist with purchasing. Do they help with the installation, or is it just the purchasing of the product for some of those assistive devices like grab bars or those special bathtubs or anything?
No, they also assist with installation. I've seen them put ramps in by front doors. I've seen them install grab bars down hallways and in bathrooms. So not only do they help with getting what you need, but also setting it up for you as well.
Great. And does that help? You know, you were talking about maybe on some of the older home steps. Does that help with maybe some home repairs?
I'm not 100% sure on that one. I'm sorry.
No, you're fine.
Yeah, no, I'll give some input on that as well, because one of the programs that I helped to work in for a while, we were trying to make those connections for home modifications. And a lot of it has to do with, do you own your home? Do you rent? And then financially, do you need that support or not? Insurance typically, unfortunately, especially most Medicare related insurances, will not pay for modifications to the bath or shower or even to the home, because it becomes then a permanent fixture in the home and it can't move with you. And they're primarily more going to fund those things like an assistive device or something that you can take from location to location. But I will say that some insurance companies, especially those that serve if you are on a Medicaid program, they are a little bit better about coming in and being able to help do that installation, because you meet sort of that financial need qualification. So I would suggest that if you live in your own home and you feel like you might financially qualify and you have at least 2 to 3 daily activities that are impaired because of fall risk or impaired mobility, you can contact the local area agency on aging. Also in our area, you can, there's a 211 that you can find that online, or you can connect with an area agency, and aging will help you connect, and they'll help to facilitate those connections that you need for some home modifications. But again, you do have to qualify both financially and then based on that you have some impaired mobility needs. And if you live in an apartment and you're renting, be sure and talk with your apartment management, because a lot of times there is some state funding that also helps to support for those modifications, and they'll make sure that they help to complete the appropriate processing and paperwork. And then depending on the apartment management, sometimes again, they want to be the ones to install it. And some of them, even if you don't financially qualify for that, or if the apartment complex has met their quota of making an adapted so many adaptive, apartments, then they will, if you'll go purchase it, which Home Depot, Lowe's, are great resources for those, and they're fairly inexpensive, they will install them. But that's a good question, Kim. I do think that the part about the handrail at the steps leading into the home is a very important one. And even again, some insurance companies and some facilities and even some programs, Habitat for Humanity, if there's enough of a need, enough of a modification, they'll come in and help to do the things that are more on the exterior of the home to help make for safe entry. So there are some programs, again, based on financial need, that will help build ramps. And our community and the area agency on aging, again, can direct you to that right program, and sometimes even install those handrails.
Do we have any callers that have, or participants that have any questions? All right. Well, thank you for joining us today. And we just want to thank you for your interest and attention and engagement. And we invite you to join us tomorrow, where we will be discussing what's available in my community to learn more about fall prevention. Representatives from a couple of our senior services programs will be sharing information about opportunities for classes that are available in our area to prevent falls. So we thank you, and we will see y'all tomorrow.